Welcome to PEP Talks, a patient experience podcast where we share stories of promise, our culture of connection and care. In this episode, you'll hear a slightly different perspective on the cancer experience, that of one of our caregivers. Getting a cancer diagnosis is overwhelming, not only for the patient, but for their family as well. We might assume that the caregiver is the one who is able to be fully present and take in all the information to help and support the patient. But as you'll hear from Jason, that's not always the case, at least not at first, as he navigated this unchartered territory with his family following his wife's cancer diagnosis.
So I'm Jason Bever. My wife Joanna was diagnosed with breast cancer in 2012, and we ended up seeking treatment here at Moffitt Cancer Center. It started for us. My wife was at the pediatrician's office with two of my children, and her OBGYN called her and told her over the phone that she has breast cancer. And she's sitting there with the kids, trying to hold it together. And then she turns around and calls me and tells me over the phone what had just happened. I pulled over on I-4 and I bawled, I sobbed, and I cried. I fell apart. The whole world kind of disintegrates. How was I going to pick out the best person for my wife, to fix this, to get us, back to the way we were? And the weight of the world just came down on me at that moment. I didn't know what to do. And then I remembered a friend of mine that worked at Moffitt, Braulio Vicente. And I tried to call him, and I told him what had happened. And I still didn't have myself together. And he said, Jason, you have to get control of yourself. You have to be together to help your wife. And he said, we're going to help you do that at Moffitt. We'll get a plan together. I'll talk to some people. I know some people. We'll figure it out, but we'll get you scheduled. You'll get in here, and we'll work it out. And at that moment, I had just lost my whole life. It disintegrated, right? And then I just got a little bit of it back. I got my legs underneath me for a second. I don't think he even knew how much that first few seconds of what he said to me, how important that was. So when we got my wife's diagnosis, I learned a lot. I'm the caregiver. I'm not the patient, which I think gives me a whole different set of fears and concerns. So think of it this way. When my wife is going through surgeries and treatments, I'm now learning what she's been doing for our family for the last 15, 20 years, right? I didn't know what goes in my kids' lunch boxes. Think of how daunting of a thought that is. I'm standing here and I have empty lunch boxes and I don't know what to get out of the fridge to put in there. I don't know how car line works, I don't know the teachers' names, how to register kids for school. I'm feeling guilty. I'm scared that I'm not going to pull this off. And, you have other guilt too. As a caregiver, I'm supposed to carry the weight and take it off of my wife. And my mind, goes to the worst possible case scenarios. What if she doesn't do well? What will my plan B be? And then I have guilt for thinking that way. And then thinking about, you hear stories where, somebody that loved somebody with cancer, scoop them up and help them push on through the most difficult times when they wanted to give up. Does my wife want that? Or if our journey is different than that, am I supposed to let her go? When we have this diagnosis, and again, I'm the husband. I'm the strong one. I'm going to take care of this. I'm going to fix everything. Don't you worry. I got this, And inside, I'm just a mess. Struggling with how much do I tell my kids? They're different ages, I think at the time, the oldest was 12 or 13, and the youngest was 8. If I tell them everything's going to be okay, and then they're not okay, what does that do to their trust in me or how they think about things in the future? And if I tell them it's really scary, it's not okay, how are they going to function every day? So as a father and a husband and a caregiver, I'm trying to balance this out and figure it out. And these are the things that were weighing on me when I was sitting in the lobby, waiting to come in and be seen by the doctors and the nurses. I know the staff and the nurses and the doctors have people like me every single day just wearing them down because they can't hear, they're not listening. And then I'm going to call back the next day and ask those same dang questions. And they were so wonderful in allowing me to work through it and to get to a place where I could take advantage of their knowledge and their information. All along the way, people did things and said things and pitched in and that just completely, I don't know what the right word is, supported us, held us up, helped us get our legs underneath us so we could, fight our battle, the way we thought we needed to fight it. The things that we took away with us were probably not things anybody would have thought were the most important things, by far. But what we go home and write on Facebook about or tell people at church or brag to other people about is the care that we got at Moffitt. And I think there's a difference between treatment and care. Treatment is you're going to get this drug for this many days. The care is when they're listening to you and they understand how you feel and they ask how you feel. And, sometimes it takes a whole team to fill in those gaps. Not any one person, some are better than others, but that's a complete package. That's hard to come by, somebody that can do all of those things. We found it at Moffitt, though. The nursing staff, the valet attendant, my wife, after surgery, my wife was in, obviously, tremendous pain. She's in a wheelchair and just had double mastectomy with reconstruction. And the valet kid, I call him a kid, he couldn't have been 16. I don't know if he could drive a car. I guess he could. He's a valet, right? He's wheeling her out, and then he stops and he goes around to a different door. And I didn't catch on, but then I saw outside that door had cobblestones and is bumpy for the person sitting in the chair. And that has stuck with me, that he took the time and thought that was that important to do it that way. There's things like that all over the institution. So there's a nurse that would take my wife's blood. Every time you come in, you go to blood draw. There was a wonderful, beautiful woman there. Her nickname is Pickles. I feel so bad I can't remember her name. My wife had a port, and she was so anxious about getting the port accessed every time she came in. So Pickles knew just how to talk to her, how to touch her shoulder. It was so reassuring to my wife. And anything that reassures my wife is good for me, right? It's a tough, long day if everybody's stressed and things are difficult and scary and painful. Pickles, she came out of her own way, like to invite us over out of the way, have us into her little bay, talk to my wife and do everything and remember, our stories and our kids and stuff. And it was just, I don't think anybody knows how important that is. Dr. Hockpour was Joanna's surgeon. She's amazing. She's fantastic. I recall one specific point in time where we were waiting on results, and it was going to either be the best news in the world or the worst news in the world, And we wanted that information before the 3-day holiday, And, otherwise your stomach's just, upside down and twisted, and you're in that dark place. You're like, it's going to be a horrible 3 days without that information, And she's just so thoughtful. Get a phone call from her, like at 8 o'clock, on Friday night. I know she's been in clinic all day long, or maybe in the OR all day long. And she's got to dictate and return phone calls and the administrative stuff. She hasn't seen her family yet, And she's making a phone call to us to make sure we get the good news so we can enjoy the weekend, That's important stuff. When my wife Joanna and I leave Moffitt and we go home, we don't remember how much of our cancer has gone away or how successful things are. What we remember is the little things that every one of the team members do for us. They don't cost money to do for people. It doesn't take a whole lot of time for most of these things. But that being present for a patient and hearing what they're saying. You can completely change how they feel about their experience. What you do, you may not think there was a lot behind that, or it meant a whole lot, or you're just going through the motions on that day. Every little thing you do for a patient is so important. We really take it to heart. You are the face of Moffitt, and when we leave here, that's what we remember, is how you treated us.
Thanks so much for listening. We hope you'll join us for our next episode of Pep Talks. Until then, keep living the promise.